So we're live now. Okay.
We're live. We're actually we're
Live.
live.
We're live.
No.
No, now we're live. We're live.
Hi everyone. We are live. We are live. We are live. This is the voice and face of Dr. Tolu Olabinton. I'm the CEO and co-founder of Living Spring Family Medical Center here in the amazing city of Mansfield, Texas, where we help our patients live long and well because we believe the quality of life is just as important as the quantity of life. If you are watching live, please hashtag live. If you're watching replay, hashtag replay. I am excited once again to come talk to you on, topics that can add flair, add joy, add meaning to our lives. And we're talking today about using laughter as medicine. And I'm honored to have back our repeat guest, Dr. Makda Majette. Did I say that well?
Yes, but it's a hard J, Majette. You know, some
Majette.
people like Majette. Yes.
Majette, Dr.
Yes.
Makda Majette.
Majette,
Okay?
yes. Yes,
Oh,
it's
man.
such a pleasure to be back. It's always wonderful talking to you, Dr. Tolu. Wonderful.
Oh, thank you. Thank you. Now, for those who are watching, oh, by the way, before we start, please, if you know guests who could use this, please forward this video to them, tag them in the comments so they can watch live. We will be taking questions live as well. Now, that being said, Doc, could you kindly introduce yourself? Who are you and what do you do?
Sure. So I am Dr. Makda Majette. I am a board certified family physician. Yes. I'm also a HIV specialist in Miami, Florida. I'm currently full-time employed. But I'm also doing speaking engagements for the AETC, which is the South Florida AIDS Education Network. And I am also spreading education around our general well-being and preventative medicine. So it's wonderful to be here. And that's you can follow me on my Instagram. It's at Doc Majette, DocMajette, where you will see educational videos that we have pre-recorded, or you can check out upcoming educational topics, as well as my Facebook, which is going to be linked in the chat as well.
Awesome. Doc, why do you do what you do? What got you? Why are you so big on preventive care? And why do you do what you do?
Mm-hmm. So for me, I do, well, it's kind of how I got into medicine, because I really cared about our condition as humans and trying to improve the human condition for as many people as possible. Because I had seen a lot of different things. So I, as a kid, had asthma. So I had been to the hospital as a young child, and I saw, how it's treated. Because when you can't breathe, that was that was the scariest thing that could ever happen, right? Is when you try to take a breath and there's no air, and you think that, oh, my life is going to end, and it possibly could if you did not get the right medical care, right? So that happened to me as a kid, and I saw the doctors and saw what they were able to do as far as creating well-being and improving the lives of people through medication, through education, and through having the relationship with patients and their families. So that's why I went into family medicine, and and that's why I do what I do.
Love it. So today we're talking about laughter. I anticipate we'll laugh a lot today. Because we're going to be practical. It's going to be a practical session.
We'll have some exercises.
Yes. Well, let's talk laughter. So why? I mean, the topic almost seems, for someone watching, is like, okay, why are they talking about this? But why laughter? How does laughter contribute to overall health, and what benefits does it have both on the mental and physical well-being of our viewers?
So I think in general, most people, even without a medical education, know that when they laugh, they feel better, right? I feel a little bit better when I laugh, and I wonder if that has any type of health or medical implications. Does it really, is it good for my health overall? I know I feel better,
Mhm.
but what does that mean medically? So, uh, excuse me. So when I looked more into this topic,
Mhm.
to see, of course, as a physician, we look into the research. We want to know
Right.
the data, right? So there's actually a systematic review that looked at all the studies published between 1950 and April of 2022 they searched for all of the studies that included the terms laughter therapy, human therapy, and its relationship to cortisol, which is one of the stress hormones. So they looked at thousands of studies and they narrowed it down to 8 that were controlled studies that looked at the intervention of a laughter-based treatment, which was either laughing as a solo person individually or having guided laughter with like a yoga laughter, which is a thing,
Interesting.
and they found that they also looked at 5 of the studies looked at the impact of watching something funny, like a comedy video. 2 looked at the sessions with a trained laughter therapist, and 1 was a self-administered laughter program. And the total number of people in the studies in the 8 studies was 315 participants.
Mhm.
Mean age was around 38.6, and they found that there was a statistically significant reduction in cortisol, like 31.9%, induced by the laughter intervention compared to the control group. And there was no evidence of like bias in the publications that they reviewed. So
Wow.
this studies have shown that our cortisol levels decrease significantly with laughter as an intervention. And
There's also
they
laughter
looked at
surgery.
different age groups too. They looked at adolescent, adult, and there were some children in the studies too. And across all of the groups, it decreased the cortisol levels. So let's talk more about cortisol, because not everybody know that cortisol is one of the hormones involved.
Before we get to that point though, wait. So the
Yeah.
actual laughter, like there's guided laughter sessions.
Yes, guided laughter sessions. Yes, is a thing.
Wow.
And there's also another thing I thought was very interesting. There's also laughter yoga therapy, and there's also just laughter therapist.
Wow, that is so cool. And for those of you who are watching who are like, okay, laughter, like we're having these conversations because we want you to enjoy life. We want to improve quality of life, even through the seasons of challenges. And so these things are, we're having this conversation to improve the quality of life because they're free. It may take some intention, but the science is backing this. I really want to emphasize that because that's big. All right, so
Mhm.
let's talk cortisol and why we care.
Yeah, why do we care? So we know about stress, right? So we hear all the time about how chronic stress can lead to all sorts of problems because it raises cortisol levels. So we have our brain, when we're chronically stressed, we have something called the hypothalamic pituitary axis, the HPA axis, right? That sends signals from our brain when we're stressed, and it sends it down to our adrenal glands to release cortisol, epinephrine, and norepinephrine as part of our freeze, fight, or flight response to stress, right? So, and every day in our office, we can get stressed about sending an email to our boss. We can get stressed about seeing seeing someone that was not nice to us the day before. Whatever it is, these things can cause chronic stress in our lives. And because this is a normal response, because evolutionarily, when there was something stressful, it was, say, a lion that was running after us. So we had to have a fight or flight or freeze and hide response. But to our everyday stressors, when this happens chronically, it can cause chronic negative effects. So these raised cortisol levels can lead to depression, obesity. It can lead to diabetes, insulin resistance, these type of things. So and so these studies show that maybe it doesn't improve causation or the specific mechanism of laughter, but we know that maybe laughter works within this axis, the HPA axis, to help improve our cortisol levels. That part is unclear, but it's a possibility. But we know that it does decrease our cortisol levels.
Okay. Okay. All right. Awesome. So can you share examples of specific health conditions that may be positively impacted by adding laughter into daily life? I don't know if you have any data on that, but I kind of want to see, is there tangible proof? Like specific diagnosis.
Okay, so specific diagnosis, like I didn't go into specific studies for the specific diagnosis,
Okay.
but we know that uh, it has been studied. Let me pull it. I know it helps with chronic pain.
Okay.
One of the first studies from it's like 1976 was a case study with an individual with chronic pain that was controlled with laughter. So at night, in order to sleep, he would force himself to laugh for 10 minutes, and that would improve his pain enough for him to fall asleep. That was an old study, and that was mentioned in the systemic review that I found. Let me see if I took a note on any other studies that may.
Oh, that's good to know. I also know it can help with relaxation.
Yeah, of course. So okay, and just in general, so as far as not studies, but yeah, relaxation, it's a health. Well, we know in psychiatry when we do our psychiatry rotations as well, because even primary care physicians, even though we're not psychiatrists, we rotate through psychiatry. We know we learn about healthy coping mechanisms, right? We learn about which coping mechanisms are detrimental and which ones are healthy. And laughter and humor is one of the key healthy coping mechanisms. So we have to remember that it's a way to help relieve stress and to prevent being mentally unwell, right? It's laughter helps us diffuse stressful situations.
So I have someone who's watching, Doc, who's like, yeah, I'm happy for you. I don't find anything funny. Like, how do I incorporate that? Do I just stand randomly and start laughing? What are tips? Like, how do we get more laughter into our lives? Especially knowing now that it can actually help reduce cortisol level or minimize the risk of certain health conditions, and overall make our lives richer.
Yes. So I say, we're millennial. I don't know. I'm a millennial. I think you're a millennial too, right? Yeah, I don't know your age, but I know. But we type a lot. We type LOL, right? Are you laughing when you type LOL?
That is a good one.
Are you laughing? I mean, laughing out loud, out loud. So a lot of times we limit our laughs. So do you know that babies laugh 300 times a day?
Oh my.
300 times a day. Adults laugh around 25 times a day. So we limit ourselves. I know we often find things funny, but because of social norms, so we don't want to come off foolish, right? Because you're not good to be laughing all the time, or that's a societal image that it's not good to be laughing all the time, right? So we limit ourselves. So until we maybe have a private moment or we're at home, a lot of time we do limit ourselves, or we will type LOL, but our faces are stone face LOL.
You know what? That is so true. Like sometimes I'll be like, yeah, that's funny. So I made a conscious decision, I think a couple of months ago. I was like, you know what? I'm going to actually allow myself to laugh out loud. One of the things we do subconsciously as humans, during work, we assume that we're going to rest when we get home. So we're like, and then you get home and then you say, I relax. But throughout the day, little bursts of laughter actually can help make the day richer because we spend a lot of time at work. And I found that laughing with clients helped me feel better throughout the day and help patients actually feel lighter.
Right. And it's reducing your stress and their stress through the day, right? It's reducing their cortisol levels, helping you feel that relaxation, not take things so serious. I mean, yes, we have a serious position, but everything doesn't have to be so serious. You know, everything. Like your well check where, you know, you just want to have a you know, friendly conversation. You may add in a laugh or a joke. It's not, you know, everything doesn't have to be so serious. So just providing that opportunity for releasing ourselves from that social construct that we have, that we can't laugh out loud during the day, right? We have to save it for the comedy show, or we have to save it for the night, or a different time, because we have to be perceived as very serious. So that's not just in our profession. That's happens to all adults, right? So as a kid, you may have giggled throughout your class, and you've done you may have gotten called out for that, which is, you know, understandable if it was a distraction during that time. But, you know, there's some leeway to have those moments of joy and releasing laughter.
Yeah, I have Miss Shauna here. She said, thank you for that comment. She said, I laugh out loud all the time, and sometimes it's uncontrollable.
Yeah, yeah, it can be. So that's good. One of the strategies that I discovered, like in like preparing this presentation, was other than going and finding a laugh therapist or a laugh yoga class, you can actually set a timer with a friend or have a group of people. It's more fun to laugh with people. It really is. I like to hear all the different sounds and the different styles of laughs that, you know, that you hear when people are, you know, people can belly laugh, people silent laugh. So having just a 1 minute, like set your timer for 1 minute and just laugh for 1 minute straight with a group and see what happens. So you will start off you will start off, you know, just like thinking like, oh, I'm a fake laughing. And then after the first few seconds, it'll become genuine laughter, because you'll be laughing. I was thinking we could do that during this talk. Let's see.
Just imagining that is funny.
Do you want to do that live? Let's see if everybody everybody, let's set the timer. So I'm gonna say, okay, Google, set timer for 1 minute.
She did. No, she didn't. Oh, yes, she did. Oh my goodness. You know,
You ready?
I'm ready. Oh my gosh, we're gonna do this live. My goodness.
1 minute of laughter. You ready? I want to hear your special laugh. Everybody's laugh is unique. So let's see.
Oh my gosh, I can't wait to do this live. I hope people are joining us and laughing, because it's good for you.
And everybody on the call, you should be laughing too. This is 1 minute, okay? 1 minute, and you hear your laugh.
Oh my gosh. I actually feel better. I just even started it too. This is good. This is good.
Yeah, we have to keep you talking, you know, but we need to do more laughing.
Your laughter is contagious, though. Yeah. Your laughter is contagious. I love it. Oh my gosh, this is such a good for this topic. I'm so happy. This is good.
Yeah. It's important. So we had a long day. So let's laugh for 30 more seconds. So I don't hear you laughing enough. So come on.
I'm trying. Oh my goodness. I love you. That's what I want to say. Shauna, thank you for giving us that comment, because I feel a little silly doing this, but I feel better doing this.
Yeah, it's so important. See, and I feel better too. Like you really feel like that sense of like, oh, you feel like, I mean, I don't know if this is the case medically, but it feels like you kind of completed the stress cycle. Like, you know how like maybe something may have been, or you had a little bit of a stressful day, and you feel like, oh, I feel that's how I feel after a good laugh. You feel like something has resolved. Like, oh, that's resolved.
It's like a burden lifted off your chest.
Yeah.
And for someone who's watching, who is like, well, good for you that you can laugh spontaneously. Good for you. Seasons are tough. I mean, the laughter doesn't necessarily change the outcome in that sense, but it gives you relief to at least focus and maybe rechannel as far as finding a solution for the problem. So we don't have to, we don't have to drag through. And so you talked about, getting a group of people laughing together, watching something intentionally, nothing too serious that will make you laugh, or having people come over and it's a natural burst. And I don't think we have to struggle. Like, I don't know how. I just hope we're encouraged. To be intentional about this. And Michelle said I'm sending my virtual laugh. Thank you.
Thank you. let me add that it's not, because sometimes, when we get to be adults or you have a lot of responsibility, you feel like, oh, I shouldn't be laughing, or you feel guilty for enjoying yourself. No, you should not be feeling any type of guilt, or you should be doing something better for enjoying yourself in a healthy way, especially such as laughing and having joy, right? So part of the reason why we're here, in my belief, is to enjoy this wonderful world and the wonderful people that are in it, and to be as lighthearted as possible. Yes, difficult things come, trials come, illnesses come, disease come. I mean, you can be in pain, but you can still find time to laugh. And it's also saying that things are not all within my control. I can take time to laugh because I'm doing my part, but there are other things that are outside of my control. So even while I laugh, things are working, right? Or I can find other people or other things to help me once laughing also helps with creativity, because it makes you think that, I don't have to think just one way. I don't have to think like I'm in pain and that's the end all, right? So when you give yourself that chance to laugh, you can think about other things like, oh, I find this funny. I wonder, it just helps boost your creativity and finding alternative solutions as well. So, never feel guilty for, being happy, right? Because it's not that you're happy all the time, or, but it's, I feel like, joy it's something that you can use to your advantage. Yeah. And you also help yourself, and you help other people at the same time too. Yeah.
Trials come, but you can still find time to laugh. Never feel guilty for being happy.
Yeah, never feel guilty for being happy.
This is good. This is good. Thank you so much for the good belly laugh. And your laughter is contagious, I gotta say.
Okay. Okay. Yeah.
Now, I have one more question. My next question for you, because we're almost out of time. Do you have any advice for someone who's looking and say, you know what? I think that fits your personality type. You're an extrovert. You sound like you're an extrovert. I'm an extrovert. So this may not apply to me. But at the same time, they want to embrace a healthier and happier lifestyle. They're looking to embrace this laughter revolution.
Mm-hmm.
Any words of encouragement to that person who's like, I don't know, you guys sound a little funny. Mm-hmm. I don't know, I want to try this.
Well, you don't have to do it publicly on live in front of whoever's in front of strangers, right? You don't have to do it in front of strangers. I mean, I am an extrovert, so I'm not I'm shy sometimes, but I'm not too shy. So, but you do it in front of people you trust, or just by yourself if you feel comfortable doing that. Or you could try a class where, no one in the class knows you, but they will get to know you, separately outside of your work. Introverts are connect with people, but they connect with people on their, not as broadly as maybe an extrovert does, but introverts have quality relationships with their family, people that they're close to and that they trust. So choose those people, a few people that you call, and every time you speak to that person, you have a great laugh. Or meet in person is even better, so you can see and hear their laugh up close, and just set that timer and say, we're gonna laugh for 1 minute because I'm stressed, I had a hard day, and I want to hear, I want to see if that'll help me feel better, and see if a friend will do that with you. And I think that may help more than speaking to a friend and you both just want to it helps to vent sometimes, but
Right.
it's also helpful to do something that will increase joy, right? So you say, I had a stressful day. Can we do our 1 minute laugh, set the timer, and then laugh on the phone with your friend and see, maybe that will make you feel better. Try to do things that will lift your spirits as much as possible.
I love it. I love it. I love it. I love it. I was even looking for um it says laughter is good for the bones. I think it's a Bible verse I'm looking for. Laughter does good to the, yeah, and merry heart really does a spirit, soul, and body good like medicine. That's Proverbs 17, verse 22.
Mm-hmm.
Laughter is good medicine. For
Mm-hmm.
those of you who are watching, I'll be honest, I was a little embarrassed about laughing for a minute. You didn't give me a heads up. I could have prepped, but
I'm sorry.
I love the spontaneity, but it's really, really, I really want to encourage all our viewers, please, please feed your joy, add bursts of laughter. Even through the stressful day, we don't have to wait to a set time. Engage with people, and laugh. Laugh,
Mm-hmm.
find things that make you laugh. It is really, really good for you. This has been so, so good, literally.
Mm-hmm.
Thank you, Shana. You did good. But it was really good. It was easy to laugh because of you too. So you are definitely someone that adds joy and sparkles to someone's life. So I really appreciate you for coming to do this live with me. I'm actually going to engage and encourage my clients too to also do this as a way to add burst of happy endorphins.
Yes, and to reduce those cortisol levels.
Yes, yes, I agree.
Cortisol levels. It also helps. I mean, I was also reading that it helps with increasing blood flow, like, helping your heart and to increase the blood flow. So, yeah, get your patients to do it. It's great. And I will discuss it with mine as well, huh?
I said, I know who to call when I need a 1 minute laugh.
Okay. Oh, yeah, you can. I'll be happy to.
Well, thank you.
I can record it and send you a one. No, I'm just kidding. I'll call you live. We can do it live.
Thank you so, so much. This has been so good. Thank you for the encouragement. For those of you who watch live, thank you so much. Dr. Tina Morbe, thank you for joining. Shauna, thank you so much. Dr. Knight, thank you for joining. So glad to see you. Dr. Walker, thank you as well. Janice, Shauna, all of you, Gracie Grace, I really appreciate you joining. So, Doc, I have people who are like, man, I like this doctor. I want to connect with her. I want to follow her. I want to see her kind of, listen to or read her content. Doc, where can people find you?
Yeah, thank you so much for asking. So you can find me on Facebook, but you can at Makda Majette at Facebook, and you can also find me on Instagram at DOC Majette on Instagram at Doc Majette. So those are the places you can find me currently, and thank you so much for having me. This was wonderful. You probably will find me on another one of these because I really enjoyed talking to Dr. Tolu. So you may find me up here again too. Yeah.
We would do this again. And you're also on Twitter. You forgot.
I am also on Twitter, but Twitter turned into Thread, and I haven't been active on, well, it didn't turn into Thread. It turned into X because Elon Musk changed Twitter to X.
Okay.
So now I know. So Twitter, I haven't been on Twitter anymore, but Threads is the new thing. So okay. I used to be pretty active on Twitter, but not as much anymore. So
all right. So follow her all over the place.
Follow me all over the place. I'm there. That same name on my Instagram. You can check me there. Wonderful. And leave messages in the comments. We'll reply with any further questions you have. Or
yes,
yeah, this was great. Thank you so much. Thank you so much.
My pleasure. And thank you
all. Your laugh was great too. I liked your laugh.
Thank you so much. Thank you, thank you, thank you. And that's it. 7 o'clock. We're already out of time. I appreciate you all for watching. As always, please forward this to your friends. Some those who could use some laughter in their life, some encouragement, just something that they can giggle. I mean, the two of us laughing, I think, is enough to even get people laughing too. So get people started on their laughter journey. And as always, if you or anyone you know is looking for an awesome, a thorough, and a passionate family physician in the Mansfield, Texas area, please let them know. I am she. Have a great night, everyone, and more laughs, more laughs. More laughs.